The Kansas Health Institute supports effective policymaking through nonpartisan research, education, and engagement. Each legislative session, KHI is hard at work, keeping you informed on the latest health policy discussions from across the street in downtown Topeka. Health at the Capitol is a KHI production, a monthly recap with our legislative monitoring team, offering you a closer look at policy work happening now in Kansas and coming up. Thanks for joining us for Health at the Capitol. I'm your host, Teresa Freed, Director of Strategic Communication and Engagement for the Kansas Health Institute. And as always, we have with us Linda Shepard. She heads our legislative monitoring team. And we also have Cynthia Snyder, another member of the legislative monitoring team. Thank you both for joining us once again.
Thank you. Thank you.
All right, so we are about to head into the special session, so we're definitely going to talk a little bit about that, but we also want to talk about sort of the last minute activity that happened towards the end of the regular session. So, Linda, if you want to just start us off with what are some of the key health-related pieces of legislation or action that we saw?
Yeah, and actually, Cynthia is going to do that part, but just a little bit of introduction. The session ended very early on the morning of May 1st. Cynthia will be talking about some of the action that happened specifically with bills during that time period, the bills that were signed during May. And then you're right, and then we'll talk about the special session.
All right, very good. All right, Cynthia, go ahead. Tell us what you know.
Sure. So like Linda was saying, at that end of April, beginning of May, there were several bills that the governor signed, vetoed, and there was also some override activity. So we'll talk a little bit about so House Substitute for Senate Bill 419. It's a interesting bill in that it provides immunity from prosecution for individuals who are seeking medical care for someone who's under the influence and in need of help. I think we'll hear more about this bill in terms of how it's interpreted and applied at a local level. So I think probably more to come on that. That House Sub for Senate Bill 287, it actually did a number of things. There was a No Patient Left Behind Act, which for hospitals and nursing care facilities, it has rules related to allowing visitors. There was also some changes in the licensure relating to emergency hospitals, rural emergency hospitals. And then there was a change in EMS regulations related to being able to provide over-the-counter medications in terms of the approved list. So those were some of the things that got signed into law at the end there, and as well as Senate Bill 28, which was basically the budgets for many of the state agencies. Within that, we'll kind of transition to vetoes because she also vetoed 30 line items. Many of them were health related. Of note, there were 2 line item vetoes related to the home and community based the waivers. And so the physical disability and the intellectual and developmental disability waivers both have significant waiting lists. And during the session, there was additional resources put into reduce those waiting lists. And the 2 items that were vetoed were putting caps on how large those waiting lists could get. And so the veto was overridden. And so basically, KDADS has to provide in January the dollar amount to the legislature of what it would take to keep those waiting lists for IDD community. It's under 4,800 individuals. And then for the physical disability waiver, it's what it would take to keep it under 2,000. So that was a big change. Now, vetoes require a 2/3 vote of each of the chambers to overcome a veto. So for the Senate, that number is 27, and for the House, that number is 84. I did do math for a second. And so a number of significant bills were overridden in terms of they had enough votes in each of the chambers to override the governor's veto. Let's see, two of those bills that were overridden were related to abortion. So House Bill 2749, which changed the reporting requirements related to abortions performed in Kansas. And then also it required that a patient be asked the most important reason for deciding to have an abortion, if it was not in the case of an emergency. The other bill related to abortion was the Senate sub for House Bill 2436, and that makes it a crime to coerce someone into having an abortion. There was also activity related to the Adoption Savings Account Act and the Pregnancy Resource Act, which were part of House Bill 2465. So that also overcame the veto. And with the Adoption Savings Account Act, it allows individuals who are planning adoption to put resources away into an account for those expenses. And then the Pregnancy Resource Act is related to tax credit for contributions to pregnancy resource centers and residential pregnancy resource centers and maternity facilities.
Okay, that was a lot of information. And there's
It
more.
was. There was a lot happening.
Yes, there was a lot happening. And so anything that you can think of that didn't get the movement or momentum that was initially thought might happen this session that we might see revived or brought new for the next session?
You know, obviously, I think each year that we've gone into, certainly over the past 5 years, bills related to Medicaid expansion have been introduced. Once again for this 2024 session, that did not happen. There were bills introduced in each chamber. One of the bills did get a hearing, but did not come out of committee, so there was no consideration for that. There was some attempt to try to bring some of that bring that up during discussions on the floor, and again didn't ultimately come to pass. So that's certainly something that was expected.
So we've heard some mention of the possibility of that being discussed during the special session. So we kind of transition over into that discussion. If you can start off by telling us a little bit about, what the special session really is for, and then what can we expect to see happen?
Right. So there is the governor on May 29th announced that she was calling a special session of the legislature. They will be returning on Tuesday, June 18th. And she has not yet issued her official proclamation for that session yet, but in her announcement of calling the special session indicated that it's her understanding that the primary focus will be on the tax bill. So the tax bill that was passed by the legislature, this is Senate Bill 37, passed very early hours of May 1st, was ultimately vetoed by the governor on May 16th. And so that left us without a tax bill for this year, which it was certainly a priority for both chambers. So they are going to be returning, presumably necessarily just for that purpose. But, it's been very interesting because we have heard of other possible topics that can come up. And honestly, Teresa, this gave us kind of an opportunity. We've never done this in the past, but had delved a little bit into just how do the special sessions work? How does that all come to pass? What can they do and can't they do during those sessions? So that's been a little fun side assignment for us to check that out.
Right. And so what can you tell us about that?
So the calling of a special session, that ability to be able to do that either by the governor or the legislature can actually do it as well, is all built into this to the Kansas Constitution and then also built into Kansas law. So in this case, the governor used her authority under the Constitution to call this special session, and again, for primarily from her perspective, I think with the focus on them working on another tax bill since she vetoed the one that had been done. There has been a lot of attorney general opinions and some other case law that's occurred since those things were built into the Constitution and state law that kind of dictates what can happen. So she is actually prohibited from, in her proclamation, either limiting which topics the legislators will cover while they're here, and also putting any time limit on it. So once she calls them back, they actually can stay for as long as they want, I guess, although there are certainly some financial constraints on that, I think, that everybody's aware of. But they can cover other topics outside of what she's called them back for. One interesting thing, that one of our questions was, can they go back and work on bills that were still being worked at the end of the original session? Right. And they cannot. Oh. Those bills are actually dead at the end of the official session. Mm-hmm. And so if there were issues that they wanted to deal with related to matters that came up during the special session, they would actually have to introduce new legislation and work that through the process while they were here. So they're not limited. They can do it, but obviously they don't have the benefit of having a whole long time to do committee meetings and hearings and those kinds of things. So it's it probably limits them somewhat to what they can do, but technically they have the ability to bring up any topics that they want.
So they can't talk about necessarily the bills, but still the topics that were addressed within bills. So, for example, Medicaid expansion. They could introduce something new.
Yes, right? And we have heard some rumors that there may be a Medicaid expansion bill introduced while they're here. I think one interesting thing that we learned is that they are not allowed to pass a bill on the day that it's introduced. So if they were to introduce any bill, Medicaid expansion or otherwise, on the 18th when they come, they would have to be here for at least 2 days because they could not actually pass that bill all in one shot in one day. So that does would suggest that they'd have to have some more time to take care of that. But again, for purposes of the tax bill, from a health perspective, really the only provision that was in the tax bill, and this again was the Senate Bill 37, was the elimination of the sales tax on food and food ingredients, and so that was something that the governor has certainly wanted, and this bill would have moved up that complete elimination of that sales tax on July 1 of this year, so next month, and right now it's still set in law that it would not go away until January of 2025. So we would be gaining 6 months of that if that's included in the new tax bill that they pass next week.
Gotcha. Okay. Well, any speculation about any other topics that might pop up?
Well, so actually, and this is totally unrelated to health, but there was a letter that was sent by Speaker of the House, Dan Hawkins, and also Senate President Ty Masterson, was sent to Clark Hunt. It's very interesting. The letter doesn't have a date on it, so I'm not exactly sure when it happened, but has indicated that there is legislation on a STAR bond that is going to be considered during the special session that would be basically reaching out to the Kansas City Chiefs to move to Wyandotte County.
So not directly health related, but definitely impacting a lot of our viewers.
Yes, absolutely. But and obviously, it would be a significant economic change for the state of Kansas if that were to occur. But anyway, I think initially it wasn't clear that was going to happen, but I think by virtue of the fact that leadership has indicated to Mr. Hunt that this is something that they're going to talk about, that at least there'll be some discussions about it, so that'll be great.
Very interesting. Of course, we'll monitor. We'll see what happens. We may not have all the details on that particular action, but we'll certainly be paying attention, like the rest of the state of Kansas, I'm sure. So, historically, these special sessions have not gone on very long. I'm sure people are anxious to wrap up their work and move on to campaigning or whatever else they need to do during that time. So. speculation again about how long we could be in.
Well, you're exactly right. This is an election year, and so it is expected that the legislators are going to want to get here and get their work done, and then get back out on the campaign trail again. That's certainly a priority for them. So, again, looking back at some of the history, it's been kind of interesting. Since, and I apologize, I have to look at my note here real quick. 1874, I think, was the first special session, and since 1874 up through 2020, which was the session where we were dealing with all the COVID-19 pandemic work, and then also some pretty major changes to the Kansas Emergency Management Act, there had actually been 24 special sessions during that period of time, and covering wide variety of topics. And it was interesting to note that those special sessions lasted anywhere from 2 days clear up to 1 year. They were here for 38 days. And it was kind of interesting because it's like one chamber came and then the other chamber came afterwards. So if you add up the total of the days they were here, it was 38 days. So that was a pretty lengthy one, and they have not typically been that long in the past, so that's very unusual. Right. But it was very interesting to note the first two sessions that happened were somewhat health related, which was the first session was related to the grasshopper. I guess at the time there was a huge grasshopper problem in Kansas, and so they were dealing with grasshopper
plague.
Yeah, grasshopper plague, and then the year after that it was foot and mouth disease. So anyway, we had these health related matters that came up, and then again in 2020, huge issues dealing with the pandemic, with COVID-19 pandemic. Right. So.
They seem to be fairly common now, though.
Yeah, and you're right. I mean, we've had them since 2020, on other topics. But there have actually been several over the years, and see what happens this year.
Yes, indeed. All right, so we want to wrap up by talking a little bit about a resource that's available through the Kansas Health Institute. We actively track legislation throughout the session. But we also want to make sure that people who come visit us on our website or watch this webcast or any of our other resources related to the session have an easy way to access the information and understand what health-related legislation was available and what happened with it. And so, Cynthia, if you want to talk a little bit about our tracker.
Sure. So at the end of each year's sessions, we put together two products, which are really to talk about what's happened during the legislative session. One is the tracker, and then we organize that by themes. So you can go and look what were the bills related to any particular set of themes. Another nice thing, in addition to being able to tell what happened with each of the bills, is there's a hyperlink that'll take you to whatever that last version of the bill, whether it's the enrolled bill, if it was a bill that was vetoed, the letter would be there from the governor explaining why she had vetoed that particular bill in addition to the bill. So it really is a nice feature. Anything else I need to add on the tracker?
Yeah, the other product that Cynthia was referring to was just we do an issue brief, and so that is really just a summary of, and again we break it down into categories that just describes the bills certainly the bills that got passed that were health related, but any bills that made significant progress through the process that were related to health, and clearly an indication of the things that the legislature was interested in is related to health. And we had a lot of bills. We have had over the last handful of years, the number of health related bills has continued to increase, and so there was a lot of things going on a lot of different topics, and so we try to cover a number of those, specifically the ones that apparently had some legs under them and made some progress.
Yes, definitely kept your team busy, and of course this webcast we've touched on a wide range of these topics, but just barely hitting the surface. The brief along with the tracker has much more information. So if you're really interested in health-related legislation, this is a great place to go to get that information. And you can receive that to your email inbox by subscribing to our emails. You can do that on our website at khi.org. Thank you for joining us. Thanks for joining us for Help at the Capitol. Sign up to receive our emails at khi.org to get a weekly recap of health policy activity during the Kansas legislative session. You'll also receive our latest publications and information about upcoming events.